primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever so relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care is the reason why I wanted to be a physician in the first place. It's the only modality that allows you to be the best for yourself and your patients. It's the way things were in the past, and it is the way things should be in the future. It is the only way I can see things going forward, especially for primary care. It is so much better than anything in fee-for-service. Living both sides of things, I know I can never go back. I am Dr. Edward Williams of Foundation Direct Primary Care, and this is my DPC story.
Dr. Edward Williams grew up in southern Alabama. He attended the University of Alabama from 2006 to 2010. He then attended the University of Medicine and Health Sciences, St. Kitts, graduating in 2015. He attended Cahaba Family Medicine Residency from 2016 to 2019, and then started working for a hospital in Foley, Alabama. After working in fee-for-service for 2 years, he started Foundation Direct Primary Care in January of 2021. Welcome to the podcast, Dr. Williams.
Thank you so much for having me.
As I mentioned before we started recording, it is so wonderful to have more representation from Alabama. We need more representation from every single state. So I definitely encourage everybody who is listening out there who has not yet been on the podcast, please go to the contact page and sign up to be a guest in the future. So let's start with your journey into medicine, because as I mentioned in your bio, you are a family medicine physician, and I always geek out over the journey of someone to go from not being a family physician to choosing family medicine, because we are Jacks and Janes of all trades.
Yeah, I grew up in Alabama. I went to the University of Alabama back when we weren't very good. And then after undergrad, I went to the University of Medicine and Health Sciences. It's down in St. Kitts. So we did our book work there, and then they shipped us back to the United States and spent a couple of years mainly in Atlanta, where I did my rotations. And that's kind of where I was first exposed to family medicine. And that rotation was probably the worst one I've ever had. This guy was, I'll be polite, but it just wasn't going to match what I had envisioned as far as medicine goes. I really liked the sports medicine aspect of it. I did a lot of rotations in sports med. And then later on down in the rotations, I gave a family medicine sub-I a chance and did that, and it was a blast. And just did a bunch of rotations with like surgeons and other specialists that I was like, man, I don't know if this is the lifestyle I really want. And so ended up really liking the kind of, like you said, jack of all trades aspect to it. You'll probably understand in this podcast that I tend to go a little bit off on tangents. So that helps with the family medicine side of things. You just kind of do everything and all things. And that, I couldn't imagine myself doing the same thing over and over and over. I get bored really easily. So family medicine really piqued my interest the further I got down into those rabbit holes. And then I really liked rural medicine. So after graduating school, my residency program was Cahaba Medical Care, and that is as country as it gets in Alabama. If you are from this place, it's in between Tuscaloosa and like Birmingham, so right in the middle of the state, and it borders Talladega National Forest. We had plenty of critters out in the parking lots of the hospitals. It is as country as it gets, and I love that. And couldn't imagine being stuck in traffic. So I really enjoyed that and then fell in love with it and haven't regretted it ever since. So that's what kind of led me into family medicine for sure.
I love this. And being a family doctor who is also in rural America, I'm like, oh my goodness, I love being able to do lots of things, and I also can relate to critters in the parking lot. So I love that. Tell me about though when you were with this before your sub-I, when you had this not
Mhm.
so great experience in family medicine. I'm wondering if you can tell us about experiences, especially with your attendings, because I absolutely remember at Creighton we had 1 month of family medicine that was like utopia, where it was
Mhm.
Superior, Nebraska, amazing. Family medicine doctors did everything, and then one medicine at Creighton, and at the time. Doesn't even exist anymore, but at the time it was like family medicine got the bottom of the barrel with regards
Mhm.
to the same simple pathology because everything else went to specialists. And so I'm wondering, especially conversing with doctors, just seeing how they worked and how their lifestyle was beyond what they were able to do as physicians doing lots of things in family medicine. What, if anything, did you take away from those conversations with the attendings that you were able to maybe see yourself embodying later on in your career?
Yeah, so it was really just one poor rotation in the family medicine aspect, and I don't want to badmouth anybody, but the rotation, we got to do a lot of stuff, but it was almost like he was utilizing the students to run his clinic, and he would kind of sit in his office and make us do everything and not really teach us anything. But we would bounce stuff off each other and test things on each other. And the patients seemed to love us, but it was just, I didn't get much feedback from him. And so I think that was just that guy specifically. But I did enjoy the all the tests that I got to do, all the tests, like all the labs I got to do, and that really kind of threw you in the deep end of interpreting everything and just got a feel for that. I think what made it poor was he just wanted us to be there 6, 7 days a week, no breaks, and he was just working us to death. I think that's what rubbed me the wrong way. There wasn't really much mentoring, not many questions, attending kind of student questions going on, but I was grateful to get a second chance on down the road. And the next family medicine rotation I did, this guy was like the stereotypical country doctor, like, let me show you everything. Here's how to do everything. This is why we do everything. Just, I think his clinic was like an old house and we had to like do notes in the kitchen type stuff. And I was like, oh yeah, this is way better. It was very close knit. All his patients knew him by, it was just an ideal situation. I'm grateful for that second rotation to kind of wash off the memories of the first one, which I'm not even sure I should even count as a family medicine rotation, but that's what it was listed on in the CV. So I guess I have to. But it was just amazing to get that second preceptor. He didn't have that glazed over look that's pretty common nowadays. He wasn't DPC, but I think he was still independent and didn't have that jaded look. So yeah, he was doing notes in the kitchen, and then he did everything from deliver babies. Obviously, his patients would it would go from just full scope. He would have his patient, they would get pregnant. He would follow them all the way up to the delivery, deliver the baby, follow up with them as the pediatrician, and then he would go do some work in the ICU at the local hospital. It was a rural hospital as well. So, and he did work in the ED and nursing home. He did everything. And I was like, my gosh, this guy is a legend. And so that's what really I could see myself doing things like that. That made up for the poor rotation the first time. And it was life changing for sure.
I love it. And I definitely would say to the audience out there who might be listening and about to approach their family medicine rotation, I've shared on the podcast before, but as Dr. Williams is saying right now, there are people like that still in practice. And definitely, I do think that you should go into a clinic where a doctor is able to broadly practice still. The nursing home rotations, ICU, deliveries, all of those things can really give you a good breath as to what family medicine doctors are able to do and are trained to do, and then you can choose from there if you want to maintain a broad scope or if you want to go more narrow. So here, I'd love if you can tell us more about your time at Cahaba because
Mhm.
being in a rural location in residency is also it's also with its challenges with regards to accessing specialists, or when it comes to even the population that we have in rural America in different parts of the country are going to have their own health risks, et cetera, just by being rural. So tell us about your experience there, and what was it that made you stay in Alabama?
Mhm. Yeah. So Cahaba Family Medicine Residency Program, I want to say is now called, it's like Cahaba plus UAB. So UAB is Birmingham, great hospital system. But backing up a little bit, yeah. So my goodness, the patients in Alabama are probably not known for being the healthiest. Just throwing that out there. That's not a secret. That's probably on some databases. We got to see some of the sickest people, the most, just trying to be polite here. I don't want to use dumpster fire, but educationally vibrant. I don't know if that's even a term, but it was super educational, get thrown into the deep end with all these like super sick patients, but it's also rural Alabama. And so we had to make do with maybe some limited resources and really, really, really get good at, maybe there's not a specialist I can send them to. The closest endocrinologist is 50 miles away, and this person doesn't even have a car. And so we really honed in on doing everything that we absolutely could, from ortho to endocrine to dermatology. Our program would have didactics and bring in some specialists like dermatologist or really anybody, endocrinologist, nephrologist, just to like, with the title of, hey, here's what you need to know in rural America. This is what you can do. This is what you need to do, or this is what you need to look out for to send them to me. Here's all the stuff that you can do out in the country. And so that was a great program for that. They were really conscious of, we're going to be deployed out into the country where you have some duct tape and some ice and try to fix all these people. That was that was great. And then we did a lot of work in the UAB system. So we were like, UAB didn't have a family medicine program. And so our program director, through his contacts, was like, well, can our residents rotate as family med through that? And we did so well, I guess they just kind of annexed us as their family medicine program. And from when I went through it like over 10 years ago, I get, oh my gosh, I'm old. A couple of years ago until now, they've expanded and added a bunch of programs and they're doing really well. But going to rotations and spending time in the UAB system, we would go into the hospitals and they would have, our attendings would know that we were rural family medicine. And so they did a really, really good job of going, hey, this is what you need to look out for to get them here. We know you're looking at it from a different angle. We know you're rural. This is what we want to know before you get them here. And they did a fantastic job at UAB Children's and the inpatient side of things and the ICU side of things of, hey, this is what you could do out in the country. This is what you can't do out in the country. And really honing us into what we needed to do before we life flighted them to a different place. But it was fantastic. I came out of that program ready to do whatever needed to happen for sure.
When you were at the end of your residency journey
Mhm.
and you were about to go into the attending space, what did you look to at that point? Did you only look to employed medicine? Did you look to opening your own clinic? What was that journey like for you?
No, really though. So I don't know. In residency, I was just so focused on getting out. I applaud anybody that has any other thought process other than just getting out of residency. It's very impressive to hearing people on your podcast go, yeah, I was thinking about DPC my second year of residency. I was like, I was just trying to get some sleep. My goodness. So no, I had no thoughts. We had recruiters come to the some of the didactics and give you some food, and that's pretty much the window to your soul at that point. And they were like, hey, where do you want to work? I was like, I don't know, South Alabama. They're like, great, here's some job opportunities. There was not a single thought of joining a private practice, starting my own clinic. I didn't know these things existed, and we'll talk about it later, but I had no idea DPC was a thing. I probably heard of concierge medicine floating on by, but that never really clicked. So I just thought I was going to get plugged into an outpatient area and just go to work, which is what happened. But I just didn't know the details after the honeymoon period was over. It wasn't exactly ideal, but no, there was no thought process. And I get students in here and residents are like, hey, I want to check out DPC. I'm like, you are so ahead of the game. It is unreal. So good for them. No, I was not thinking about that at all.
And you and I the same, man, because I didn't even know it was a thing until I had been in practice as an attending for multiple years because that was also my journey. It was like, where am I going to be an employee? That was all I thought about also. And I love that you were just focusing on getting sleep. That's so relatable to so many of us. When it comes to then taking a position, I'm wondering with these recruiters giving you a list, how did you then choose your place that you were going to work? And did you stay at that place between residency and opening Foundation DPC?
Yeah, so we settled on South Alabama. It's a county, it's on the water, it's Baldwin County. We came down here because I grew up in the neighboring county, and then my wife and her family, they're from Baldwin County. So we're going home essentially. And they had an opportunity that was really close to our homes, and I always wanted to come back home. I knew the area. I grew up around here, and her family was here, so it kind of was a no-brainer. I went and interviewed at a couple of different places, but they were in hospital systems that in the little towns that they were in rural Alabama, it just didn't seem like much building was going on. It was like a lot of closing things down. There wasn't a lot of things that were new, and I just didn't want to jump on a sinking boat. No offense to them. I just didn't feel like it was the right spot. My wife was uncomfortable, and then came down here and interviewed, and at least the area was familiar and it wasn't going the wrong way. So we took the position down here. And then, yeah, I stayed here. I stayed at that employer until I decided it was time to open my own DPC clinic.
Awesome. And how was life there, especially because you were there for 2 years? And then I'm sure there was a difference between day one and day that you left in terms
Mhm.
of demands that you had as a physician in fee for service. So tell us about your experience there.
So day one, I was a pretty cocky new new graduate ready to roll, and they put me out into the clinic and I started seeing patients, and residency trains you up for anything really, and things were just going, it was going okay. But I was ready to see as many patients a day. That's what I was trained for. I was ready to do that. And then I started noticing in my schedule ways to make it more efficient, more, if I'm going to see a bunch of patients that are on warfarin or something, I was like, let's stack them all together and just run by them and stick their finger and check their INRs. And every time I had an idea where I was like, okay, manipulate my schedule, put 10 of these and at 8 o'clock and we'll run through them and do fine. There was always this like weird pushback. And once the honeymoon period was over, we're kind of getting into the villain story right now. Once the honeymoon period was over, I was like, hey, we need to do this for my diabetic patients. We'll get all the A1Cs done at like one time. I was like, well, I can do like 50 patients a day. Like, what's the holdup? And they kept rejecting me as when I was trying to manipulate my schedule. I was like, well, why are y'all messing with my clinic? And one of the administrators was like, it's not your clinic, it's ours. And I was like, oh, that's how it's going to be. And then that's kind of when a light bulb switched. They just want me to work here. I've got no control over who I see and who I can't see. And then that was kind of day 1 through 30. I think they quoted that like probably 3 weeks into it. It was real close, real early. And that was in 2019, November. And at that point, I was like, well, I'm not going to do this for my entire career. These people are already getting on my nerves. It's been 30 minutes. And so I was like, I told my wife, I was like, it's a 3-year contract. I'll do this for 3 years and then we'll find something else to do. And then 2020 rolls around, early 2020 rolls around, and things start happening that I'm sure we all remember. And the administration was just absolutely coming up with some wild ideas as far as patient care goes, and as far as like telling me to wear a t-shirt over my face for PPE. And I was like, guys, no, we cannot do this. And so March through the summer of 2020, I really didn't have many patients coming into the clinic because everybody was scared to come into the clinic. But I was a good little employee, so I had to be there from 9 to 5 every day. And that was the first time I ran into DPC. I was like, there's got to be a better way to do this, because I was getting reprimanded for calling my patients and not telling them not to come into the clinic because it's just your mammogram's negative. You do not need to come to the clinic. And they were like, you can't do this. And I go, well, I'm holding the phone. I just told the patient, so clearly I can do this. You just don't want me to because you can't bill it. And so I got a lot of those, and I get where they're coming from. But yeah, they also told me I couldn't go to Home Depot to get N95s. And I was like, I'm standing in the parking lot. I'm going in. They didn't like that either. So there was a little bit of friction, to say the least. But anyway, during the time where I was not seeing patients in the clinic, I just sat at my desk thinking of ways to get out, and ran across this wild and crazy modality called DPC. Went to the like virtual DPC conference, and I was like, there's no way. There's no way this actually works. Went down that rabbit hole, and after the conference came out with a business plan, and did some things on my own a little bit, and then came to the conclusion that I was not great at it. And so went with a consulting company, did great. And then September 1st of 2020, I walked into the administrator's office and handed him a letter of resignation, gave him 90 days. That would take me out to like November 30th or something. All the while, this company is helping me put together the business. And then I took December off to paint the new clinic and get some other stuff done and kind of decompress. And then opened in January of 2021 at a little bitty clinic. It was like 800 square feet. It was like one big room and had a bathroom that didn't probably wasn't up to code, but it was a start. And man, I do not regret a minute of it. That's for sure.
I think it's fantastic. And I think that everyone can absolutely relate to like, I am physically telling somebody that their mammogram is normal. So don't tell me I cannot do that. And it really speaks to this autonomy and lack of autonomy that drives a lot of us nuts when it comes to being employed by someone who doesn't even have any medical degree whatsoever, telling us about what we're going to be doing that day or what check boxes we have to check off. Tell us about this transition point now, because you had handed in your resignation. Was there any issue with non-competes? Was there anything that they were holding over you, like tail insurance, that could have, in one scenario, held you back, but yet you chose to continue to go forward into DPC?
Yeah, there was actually a couple of contractual, I'll just call them burdens. It was interesting because the way the contract was, my first year, they were going to pay me strict salary and then add RVUs to the tail end of it if I exceeded the salary. So I was working my tail off before COVID hit, and they were still paying me X amount of money every 2 weeks. And then COVID rolls around, and my patient RVU stuff just bottoms out because no one was coming to see me. But I was like, hey, joke's on y'all. I'm on salary until September 1st. And so that was kind of my, let's just say, evil side. As soon as my contract switched over to RVUs, I handed them my resignation. But yeah, so in the contract, there was a non-compete. It's 20 miles away from the clinic I was in and the hospital system. And I think Alabama has gotten better about this since 2020 or whatever it was. But it was for 2 years. I couldn't practice medicine, which I'm not going to go to war with them over that, but there's no way that's legal. 20 miles away from the hospital or my clinic I was in. Luckily, the place I was trying to get to was on like the west side of things and everything else was on the east side of things. And so I opened a clinic up that was like probably 800 yards away from the Google Maps radius where 20 miles was. So that was that issue. And that was okay. It was a little bit of a drive for the first couple of years. But the other issue was the sign-on bonus. If I discontinued my contract prior to 3 years, I had to repay my signing bonus. But I think the way we worked that out was they underpaid me X amount, and so they just kind of canceled it. But I think those were the only two big issues. They did send me a cease and desist letter like 3 weeks after I discontinued for like they thought I was soliciting because they somehow thought my home address was like my practice location. And so I had to respond to that with a lawyer. But that was really the only kind of speed bumps as far as the contracts go. But yeah, I would highly recommend reading that contract before you sign a non-compete. If I could do it over, and this is definitely a rookie mistake, but yeah, definitely read the contract, make sure there's no non-compete that would hurt you for sure.
When you opened Foundation DPC, you're in an environment where there is no other DPC at the time that you're opening. So tell us about you had this space, you had somebody helping you with setting up the DPC, but because you were like your wife's family and your family are from this area-ish, I'm wondering, did that help you? I would assume so in terms of getting people to say, "Oh my gosh, Dr. Williams is still in practice. He's not retired and he is here at this place that we can physically see him at."
Yeah, to be honest, I felt like I was just starting from absolute scratch because the clinic I was in, obviously, it's like 30 miles away now. And the main patient panel, I was taking over for a doctor that was retiring. And these are all patients like from the little town that it was in. And I hadn't been with them for very long. It was less than 2 years. And so to me, yeah, when I started the clinic, my base was a couple of patients that just came with me. It was like 30. It was not wild and crazy. But when I opened the clinic, it really felt like I was starting from zero because A, there was no DPC near me. There was one guy on like the DPC mapper. I tried to call him and I couldn't find his website. I should probably do a wellness check on him. It's probably too late for that. It's been years. But he's the only one that like even had something on the website. And that was on the other side of Mobile County, which is way far away. So I was the first one in Baldwin County to do it. And so the biggest hurdle was really attacking the marketing and really just honing in on if somebody per chance wandered into my clinic, just absolutely blow their mind with the service. And that kind of spidered out the word of mouth type of marketing. I joined it's not a BNI, but it's a business group. It was called the Business Roundtable. Similar to how a BNI works, you just kind of go around, tell you what you did, and try to refer business to you. I joined a couple of those. That was indispensable. And mainly, it would just blow their mind to have a doctor in the room. That was pretty much all you had to do. Like the bar is so low, just don't trip over it. But I did a lot of that, and gradually, the panel grew. But yeah, it was pretty difficult. And I'm an introvert by nature, and going to these chamber events, I would have to sit in my car and like psych myself up with music to like get out and go introduce myself to strangers. Oh man, that was rough. But as soon as someone came into my clinic, you would just blow their mind with what this is, and they'd go home, tell their family, friends, neighbors, and then it just kind of takes care of itself. But yeah, when you start, and especially down here, there's really not many DPCs in this area. Pensacola, Florida is the closest area that has a pretty good hub of what we do. But around here, this was a fresh concept. And there was a lot of, what are you doing? So there's a lot of that. But without, I'd say pretty close to starting from absolute scratch as a nobody, building it up a little bit, like one day at a time. And some of those days were pretty slow. But yeah, just there were quieter days for sure.
I love it. And I hope that that also just, especially for the listeners who are like, yes, I know what he's talking about because I'm living it right now. Your journey is an example of where things have changed very much from how it was in those opening days. Let me ask you here though, before we keep going on with your story at Foundation, I'm wondering if you can tell us like what the top three reasons that people joined your clinic were, because here in Arnold, it's accessibility. And I'm wondering if
Mhm.
it's similar to you because especially you're rural.
Yeah, so I'd say the top three, they can't get contact with their own physician. They're upset with their physician or something like that. They can't get in when they need to get in. That's one. Oh man, inability to talk to their physician. The guy or girl will brush them off or just be on their computer. They don't feel like they're listening. They only get one complaint and then they're like, all right, see you later. And then a lot of people never had the ability to have a physician that they could pay for. They don't have insurance and they're not going to go to the doctor and pay $300 to fix their sinus infection, which I mean, I understand that, but this was the first modality minus some like charity care out there that they could have a physician. Those would be the main three reasons. So they're upset with the current system, not listening, and then just fresh availability or a unique availability. That's the main three, I would say.
I'm wondering in those quieter days, were there certain things that you were like, okay, this is my clinic, this is the way I'm doing it. I did have these thoughts about like how we can get the Coumadin people all bulked or the A1C people bulked. When you had autonomy over your schedule, are there tools or tricks that you employed or discovered in those opening days that you still use to this day?
It has changed so much from day one. I'm trying to think because the way things roll now is so much different. Plus, when I only had 50 patients, it really wasn't that difficult to draw their blood and follow up with them a week later. And it's like, oh yeah, Mike, I need to call Mike. Nowadays, it's a little bit different, but the first days, the flow was super simple. It was really like the typical get everything done in the first visit. You really focus in on getting their chart all nice and tidy, having notes for when they follow up, and they're not texting. If you only have 50 patients, they're not going to text you at all hours of the night, and that's fine. Then when you get up and patient load, the way it goes now, I don't know if you want to talk about the AI implementation just yet, but it would get busy. And then I decided to, like, I can't handle all these phone calls. I can't handle all these blood draws. It's kind of like when you get there, when to take on help. And some people are different. Some people love to do this. They're built for it. They have a very high tolerance for this kind of stuff. I would probably say I don't have a very high tolerance for phone calls and stuff like that. And so I got to the point where I was looking for an MA around 150, 200 patients, and that was a lifesaver. I've been blessed with like some all-star MAs. And I think it's because they've worked in fee for service and they're like, oh, you do what? No, 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 we'll go with you. And so their workload's way easier. And so I hired a first MA. She had to leave to go live with family, which I guess is okay, whatever. I'm just kidding. She's fine. And then I hired another one and she's doing great. Her name's Jordan. She's she's awesome. But eventually it got to the point where there's so many phone calls and incoming messages and stuff like that. Like it was taking her whole day to answer phone calls and reply to them, like do the customer service thing, that I started looking at like, how do I free up Jordan to do MA stuff and not answer phone calls? And so I looked into some AI answering services, and if you're there, I would highly recommend doing so because you can program these things to answer it. And I know where I'm located, but it is so funny because a lot of people don't even realize they're talking to a robot. And it's a joke, but you choose your avatar and you choose the voice and you can choose their attitude and their inflection and stuff. It's incredible. I was so close to choosing this voice that was named Leroy, and he sounds like he is from South Alabama. And I just couldn't. I was like, oh God, that'd be too funny. I got to keep it a little bit serious. So I went with somebody else, but I was that close. It would have been hysterical, but I guess I have to be a little bit professional with this. But the answering service does so good, and you can program it to answer the questions how you would program it. And you get to it's every phone call is like listed out like almost like a SOAP note. And you can tell where you need to modify the answer to the AI. So you can go back into the system and go, no, our office hours are actually this, and this on Fridays. So that has been a lifesaver. It's like $50 a month for like 250 minutes. And it is an absolute game changer. And it triages what's important, what's not important. If somebody's calling like, hey, how do I schedule a visit? It's like, I'll go to the website. It's amazing. And it has been an absolute game changer.
I love this. And as you talk about growth, I think it's great to hear how your staff and how your tech stack has even evolved since day one. I'm wondering if you can tell us here about after hiring Jordan, at what point in your growth did you then bring on Wendy, who's the nurse practitioner who works at Foundation?
So Wendy and I worked together when I was in fee for service 5 years ago. She was my nurse practitioner in my clinic. And so when I was developing the idea and frustrated with the system, and she was she was the one I was bouncing the ideas off of. And she is a living saint, and everybody loves her. And when I was starting DPC, I was like, you should come with me. And she was like, no, you have not done anything yet. I was like, yeah, that's probably a good idea. Let me blaze the trail, and then I'll call you back. That was in 2020, and then 2021 I started. And we always had mutual patients. And so every time one would come in, they'd go, yeah, hey, Wendy said hello. And I'd go, yeah, well, when I'm ready, tell her to give me a call. And that's been for years and years and years. And finally, my panel has gotten up to the point where we're okay. I'm going to maybe limit how many new patients I can see, but I also want to continue to provide for people that would like this kind of stuff. And so the stars kind of aligned. I'd interviewed a couple of nurse practitioners. They they were funny. They came straight out of like their school and sat in front of me, and they're like, how many patients do you see a day? And they just completely just did not get it, which to each their own. But I find it very useful for somebody that's already been tortured in the system to know what they're escaping, instead of telling somebody you don't know how good it is and they don't even know what the other side is. Anyway, I digress. So our clinic gets to the point where it's okay. At the time could work for another provider to be in here. And so one of my patients comes in and he has something going on that's pretty serious. And I'm like, you need to take this to Wendy, because he was part of her panel too. She was at that point, she was the insurance, their Medicare or something. And I was like, you need to go talk to Wendy. She needs to send you for a CT. And so he did. And every time he sees her, he's like, hey, Dr. Williams has got an office ready for you. And just the stars aligned. And she finally called me, and she was just reporting on the patient. And then she kind of trailed off and goes, hey, tell me what you do again. And I go, oh, there it is. All right, finally the hook has been set. It's taken 4 years. But I told her what I was doing. It just turned out that her contract was being renewed with the hospital system. And it was not looking great. And so she was inquiring as to what I did. Told her what I did. I was like, yeah, this is exactly how it works. Come and see me. She came and saw the clinic. I was like, this is what your office will be. And they had her shoved in a shoebox at her other clinic. I was like, this is all yours. And you can make your own schedule, and your patients are your own, and you'll love it. You can go to your daughter's field trips and all sorts. And it just still didn't set in. She didn't understand what I was trying to get at was like, I'll give you your time back. But she gave me a chance, and she joined us a couple of weeks ago. Already has like insane amount. She probably has like 35 already. It's been like 2 weeks, but she's has such a good reputation that all these patients from that area, which is like 35 miles away from here, are like, yeah, no, we'll come however far it takes us. But and they're pleased to kind of hear that we don't drag them into the clinic for random reasons. So that's kind of putting them at ease. But she's doing a fantastic job. And then it really didn't click until she was like, hey, I've got a field trip to go to tomorrow. Is that okay? I was like, why are you asking me? Just block your schedule. Go for it. And then she texted me like while she was on the field trip, like, I cannot imagine doing it any other way. And she's very grateful. But it's just time. And I'm so, I don't know if I guess lucky. I've never put much advertising out or anything like that. I just kind of like the other nurse practitioner interviews were people that were my patients are like, oh, I know a nurse practitioner. So it wasn't like me advertising, but if I could cherry pick anybody, it would have been Wendy. And I cannot complain about that. She was the only one I was like, yeah, name your price, let's go.
I
You
love
can
that.
do whatever.
When you guys came together when it comes to finances, how did you structure it? Is she a 1099? Is she a W-2? And is her compensation changing based on how many patients she has on the panel?
Yes, great question. This is what I would hit rewind on your podcast. Like every time someone mentioned this, I would slow it down and hit rewind and get all the information I could. But what I ultimately decided on was she'll be a W-2. She has a salary. And this is mainly because I know her so well. If it was somebody that I did not know what their work ethic was and what their drive was, it would probably be a different answer. But with her, I'm very confident in her ability to treat patients. Patients love her. She works incredibly hard. So I went with a W-2 and a salary, and then she gets X amount of salary increase per 100 patients that comes on board. And so I we'll see how it plays out, but I foresee that it's going to be okay. And that drives her to increase her patient panel. And as I told her, I was like, I won't let you starve, but I'd like to, it's necessary to go hunt them down. We need to get your panel up. And so I think it's the best of both worlds. But yeah, she's W-2. My MA is a 1099. And that's mainly so she has the freedom to come and go as she pleases. She's welcome to do W-2, but she prefers 1099 for the freedom of, hey, I got to take the day off. Okay, that's fine.
Awesome. And has Jordan's workflow changed because she is working with both you and Wendy's panel, or are
Mhm.
you guys looking to bring on a second person to do a job just like Jordan?
Yes, I think Jordan's schedule changes every 30 minutes. She's like probably gets annoyed with me every time she hears my office door open because it's like, all right, policy update. It's like gotta be a couple of times a week, and she's just trying to keep up. But yes, there are definitely some kind of flow issues with Wendy because she's just getting a ton of new patients. And when there's a new patient, I really try to focus in on them having a really great experience in the clinic. And so if it's my patient, I kind of go get them from the front area, bring them back, and just throw them in my clinic, do everything I need to do, and free up Jordan to mainly not deal with, but triage the new patients. Since then, and that was like the first couple of weeks. And the cool thing about this stuff is that we can modify our flow really quickly. And so the first week I was like, it's going to be bumpy. Let's just see how it goes. And then the second week, I was like, okay, here's where we need to improve. So what we've done is just stagger our office visits. I start at 8, Wendy starts at 8:30, and then they go each 30 minutes. There's really not two people walking into the clinic at the same time awkwardly. So that's worked very well. And then once this new patient tsunami stops with Wendy, we can modify it again, but trying to make it as easy for Jordan as possible. Not to mention, like, all my patients, they still need to be seen and stuff like that. But right now, we just kind of work as a team. And if I need to draw blood or do vitals or do anything like that because Jordan's busy, that's always been a thing. So that really doesn't bother us. But yeah, there's some certain things that we're still trying to make efficient with the new flow. But yeah, it's definitely a day-to-day type of thing.
I'm sure when Jordan listens to this, she's going to be like, uh-huh, uh-huh. So it's awesome. When
Yeah.
so tell us now about the I want to focus now on this idea that if you've seen one DPC, you've seen one DPC. So you're unique because of where you are in Alabama. You're unique because especially like you and your wife are from the area and people knew you and people knew Wendy. But tell us about the unique services that are at Foundation because I really also want to say here again, I love that you called out how people didn't even have a way to pay an affordable rate for accessing healthcare. And that's, its own amazing aspect about your clinic. But in terms of the services you offer, tell us more.
Mhm. So this may not be as unique to our people, but yeah, some of the services is pretty amazing what the DBC clinic can do. We are not bound by the walls of our clinic, and I really enjoy meeting people where they need to be met. I've done I've walked into dental offices and they're like, "Who are you here to see?" I'm like, "Dr. So and so." Like, "Oh, do you have an appointment?" I'm like, "No, he has one with me." And it just blows their mind. It's so funny. I've met people at the grocery store because that's where they were going and that's where I was in the area. I was like, "Hey, I need to lay eyes on you for a second." And they're like, "Oh, I'm at Publix." I'm like, "Which one?" And so you just have when I'm training somebody, I'm like, if you have the opportunity to do something that's absolutely just mind-blowingly legendary, take it. They'll tell stories about that, and that's advertising. And so we do a lot of home visits, not a lot, but when it's necessary, it really helps some of the patients out by doing home visits. Like I said, I've done parking lot visits, the ability to be flexible with what you're doing. I mean, I have a stethoscope that's just sitting in my car. So if somebody's like, I can't make it into the clinic, but I'm sitting in Publix parking lot, I'm like, are you having trouble breathing? They're like, it sounds weird. I'm like, all right, I'll be there in a second. So that would be extremely unique to that as far as the clinic stuff goes in the area. There's definitely not too many people doing that. I hope that answered your question. Yeah.
Yeah, one of the things I love about your clinic is that you have this 24-hour response promise. So can you tell us about that and also how you have woven in specifically men's health into Foundation DPC?
Yeah, so the promise to the patients was that, and this is why the kind of cap was around a certain number, was I I promised my patients that one of us from the clinic will respond to you within 24 hours. And if I can't do that, it means I've gotten too busy, and that's what the promise is. I will not get too busy for you. And so that is going to be where my maximum capacity will be. And it was brushing up against that pretty regularly about a month ago. So that's why Wendy showed up. As far as the men's health goes, there's not a lot of, I just find this to be primary care. I don't feel like it's a different situation. It is just my male patients sometimes come in here and they haven't had a physician look into what could possibly be causing all these issues with mental health, fatigue, gaining muscle, like motivation, drive, sexual health, stuff like that. And so I started looking into why that's a thing. And a lot of them were coming in with like really low testosterone. And it just started blowing my mind as to how undertreated it was, at least in my area, or how inappropriately treated it was in this area. Like there was this online stuff. I don't want to name them, but I'm sure just me talking about it will make everybody's algorithms start popping off on these things. But they were being treated by like online like apps. And I was like, guys, this is not safe at all. These are inappropriate for everything you got going on. Anyway, I started diving into it and started treating these patients appropriately. And these guys are some of the most improved patients that I've ever treated just by listening to them for 20 minutes, getting some labs, and then going, oh, well, let's give you this to make you feel alive again. And they come back, they're like, Doc, I get so many messages saying, Doc, this is great. I feel a million times better. I'm a different person. My work is going better. My relationship is going better. Like I feel like I'm alive again. And so that was extremely gratifying, selfishly to me. And so and with all due respect to the guys out there, most of us don't come to the clinic anywhere healthy unless it has something to do with hair loss, which I'm an expert, erectile dysfunction, or like testosterone issues. And so I made a website that just highlighted that and just threw that out there. And it just, all it does is just funnel it right into the DPC. And that's how I've been like getting my SEO out there was, hey, this guy pays attention to that kind of stuff. But when they show up, they're like, well, I also have high blood pressure and my cholesterol is off. I'm like, cool, I do that too. And so under promise, really over deliver kind of stuff. And that's been going on. Like I made that website probably 3 years ago, and it's taken off because once you help this guy, they go back to their guy group of friends, and their guys are like, hey, what are you doing? You look amazing. You feel amazing. You're different. And so like word of mouth times a million if you fix up one of these guys. And they are the perfect patient because what we thought was ADHD or depression or anxiety or marital issues or psychological issues is really all tied down to one thing. And they get they get healthy, they start feeling better, and then they love you, start sending you Christmas cards and stuff. And I'm like, man, it's just what I do. That's been a ton of fun, and it's very gratifying to see these people getting a lot healthier. And it's mainly because I don't know why, but I don't know if there's a taboo around testosterone issues or erectile dysfunction issues. I mean, it's not fun to discuss outside of the doctor's office, but it's so common and so important that it'll really change your community if you have a practice that is addressing this in a proper way. And it's been so fun to do that. That's been great.
Now I want to go back to your tech stack because that is my jam. That is where Marielle gets so squirrely and so excited to learn new things. And I loved hearing about your phone tree and your phone answering system. And I'm wondering if you can tell us more about the tech stack that you have and how has it worked with this tech stack, bringing Wendy into the fold as well as Jordan adjusting her workflows.
So it all stems from the EHR that I'm using, and it is allowing many, many different things all in one place. And so it really helps with the clicks. It really helps with the flow of everything. You get full control over everybody's ability to their schedules, obviously, how long their patient visits are. And so, and communications is really all in front of your face. So that part of the stack is the absolute keystone. And then everything else is built on top of it. Everything else flows into it as far as like emails go, as far as our AI answering service is great. It ties in. So what I have it doing is when somebody calls the office number, it forwards it to the AI. AI picks up and does its thing. And then when it's done, it sends a message to the EHR saying, you got a call from this. That's an extra click because I have to come out of the EHR and go to the AI, and that's how I see what the message was. When the patient or individual calls the office number, it automatically creates the case where it has the name, the time, the date when the call was there. But I have to go into the AI. I would assume that my specific EHR is probably working on something like this. So maybe it'll be obsolete in the near future, and which would be great. That's fine. As far as your favorite tech in the clinic goes, that would be the Butterfly IQ that I have. That's fun. And again, like I said, if you can blow somebody's mind, do it. I found gallstones, I found DVTs, I found a ton of stuff that they don't even know I have it. And it's like in my desk, and I just plug it into my phone and just like, yeah, you got a gallstone. See that? That's a gallstone. I'll call your surgeon. So that's been fun. Really, not much other tech. No, mainly it's the EHR, the AI, and we are really analog minus that kind of stuff. But I knew you'd get a kick out of the butterfly because I hear you talking about it all the time.
Absolutely. And I totally agree though, because I mean, I even used it yesterday. A lady was having a cough and I was like, opening my little case. I copied Dr. Kissy Blackwell and I bought a little case that you store like a microphone in. So it has like the foam. So I store my IQ in that. And I just casually just plugged it to my phone and started like getting the gel ready. And then they said, "Is that an ultrasound?" I'm like, "Uh-huh. Yeah."
Yeah.
So it's
Yeah.
like, yeah, that's just what we do here. So I love that. I love that that is a value prop. And yeah, like it's definitely a cost up front, but I will say that especially if you're rural, oh man, the patients lose their minds about the things that you're able to do. And when you're able to use POCUS, it adds a completely different level to what you can offer in a rural environment. So I love that.
Oh yeah, for sure, for sure.
So as you've shared, I want to ask this because it's been amazing to hear this portion of your history, choosing family medicine and then going into an employed position and then opening DPC. But I'm wondering if you could talk to us about how you think about DPC and how it's changed your life personally and professionally. Because I know you mentioned like Wendy and her daughter and going to that field trip, but like, what about your own family life and your own ability to balance being a professional physician as well as a person outside of medicine?
Yeah, no, great. God, that's kind of the why. Yeah, so I remember when I was in fee for service, driving to the clinic, it took me about 27 minutes. And all I could think about was how many half days I have until Friday. And I would work until like everybody has the same stories of like working till like 6:30, getting home. I'd get home at 7. My kids would be in bed by the time I got home, and I was just like missing everything. And at the time, I think I only had 2 kids, but I would get home and I'd miss everything. I'd leave by when they were waking up, and I'd get home after they went to bed. And I was like, I don't want to do this. This is breaking my heart. I'm missing these things. You only get one go at it, and then the chapter turns. And so that I don't know if that was, it probably wasn't the main reason I went into DPC, but it was probably the most obvious change was the ability to be present at home and just take the time for my family. I mean, since then, now I have 4 kids, and the oldest is 6, all the way down to like 18 months. And if they want to go get yogurt on a random Wednesday, that's fine. I took my 2 oldest to the Minecraft movie a couple of weeks ago on a Wednesday at 1 p.m. I just blocked my schedule. I was like, they've never been to a movie. This should be fun. They're old enough to maybe behave themselves. And I sat in the back and laughed the loudest person in the entire theater. My boys were like, "Hey, you need to hush." I was like, "Jack Black's hilarious." Anyway, but that is something that is absolutely invaluable to me is being able to go to my kids' soccer practice, taking time to go eat lunch with them or something like that. That alone is worth all the bad things of all the days that you're wondering if this thing will actually work. But when my kids get older, I don't want them to just remember me going off to the office. That's how I remember my dad doing things. I would wait on him to get home, sitting on the front porch and just wait. We never did anything like a random Wednesday movie type stuff. And I know I wouldn't have done it in fee for service, working until 8, 9, doing charts on the weekends. Like, absolutely, it, I think it's insane being on this side of things. And I wouldn't trade it for the world at this point.
And just even in continuing on that thread, I'm wondering if you can speak to us about success, because I think that that is absolutely a way to measure success in terms of, are you achieving your goal in terms of work-life balance? But I'm wondering if you could talk to us about other ways that you found success, and that could be a day-to-day example, that could be an overall example, because now you're 4+ years into this amazing journey, and I want the audience to hear that success is not the number of people that you have in your DPC.
Yeah, excellent. I don't even know if I define success in any way because I think it's a moving target. Some days I feel successful, as in I did okay treating my patients. I don't think, I think I did the correct thing. I fixed somebody. Somebody was happy with the way I did things. Somebody got better. Somebody improved. Somebody was cured. You get a message every now and then saying a Google review or something that says, "Great job. This is the best doctor ever." But I would, I don't want it to be there because I always want to have something to move forward to. So I don't really want to define it as, I definitely wouldn't define it as any number as far as patients go, because I never felt successful or unsuccessful based off of how many people were on my panel. I guess I would feel more successful when somebody did a good job or felt better or anything like that. That's how I would define success, but it's always a moving target, and I appreciate it to be a moving target because I never want to be okay with where I am, if that makes sense. I don't want to be complacent. So I think success is also getting to see my kids whenever I need to or want to. They may get annoyed with it, but I think that's pretty successful, having the time and ability to do stuff like that when you want to and however you want to. I think that would be the sign of success that I was looking for.
I love it. What do you see coming down the pipeline in the next 4 years of Foundation? Because you shared how you were feeling that, I don't know if I'm able to keep my 24-hour promise. You brought Wendy on, her practice is growing. Do you see more things happening for Foundation in terms of bringing on another physician or provider? or expanding to another branch of your clinic?
Yeah, I'm not going to say no to really anything. If somebody comes along that fits our kind of personalities and wants to do something and it just works, I'm not going to turn something down. That right person, wrong time, you always go with the right person. We'll make it work. I've never really had the attitude of this is it. This is it. This is the only thing. Like, no. If if fate happens to like lead us down a certain path and things line up, I'm always open to it. I could definitely see opening another location just to make it easier and more accessible to some of the patients that do live a couple of miles away. I've got plenty of patients over across into the next town. That wouldn't be out unreasonable. But yeah, I think all options are open. If I find I got so spoiled with Wendy, but if another nurse practitioner comes and she matches how we do things, always open to that. And I have a very simple test for when somebody comes and presents me with something. All they have to do is go, hey, I looked at DPC. I love what you're doing. I think it's amazing. Here's my ideas. But rarely do people walk into my clinic and start off with that. That's how you get my attention. Most of them are like, here's another laser therapy that's $100,000 a month. I'm like, you have no idea what I do. The door's right there. But I'm always open to ideas and feedback. And if things line up, I would probably never say that's out of the question for sure. So I'm open to anything.
I love it. And I think that it's the thing that I keep on saying in my head with your answer about success and with this is just like you are a true entrepreneur, because that is how entrepreneurs, they dream and they make things happen. Somebody had said this to me and I thought it was amazing, and I didn't think about this, but it is so true. We are the people that can dream and build. And it's the, people who are buying out businesses, whether that be VC or PE, they don't have the ability to dream and build like we do. So never, I say this to the audience, especially, don't ever lose sight that you are building something that others are not capable of building. And you are able to build relationships and build access to healthcare where other people cannot do that. And so it's an amazing thing to be in this movement. With that said, what would you say to those doctors who are still in the fee-for-service system or are in residency under a fee-for-service flag, in terms of you need to think about this when you are questioning whether DPC is right for you and your patients?
Mhm. Some of us get caught up with the wrong kind of currency. Money is one thing. If we work hard enough, we can always attain more money. If it's a golden handcuffs type of deal, each story is unique. But if you're fearful of losing money because of going into DPC, that may be that. I mean, that's a legit fear, but the currency that you need to be thinking about is time. We do not get more time the harder we work. And so if you have something important to you, do not wait, because it's only going in one direction. And my big thing, or a big thing with me, was spending time with my family, my friends, and I wasn't getting that from my fee for service job at all. It was just poisoning me. And this is the way to do medicine. This is probably the only way to do really primary care that gives you both currencies, which is time. And I mean, obviously, I'm not going to let you starve, but that's that's what I would try to hone in on. A lot of answers stem around the just do it, you'll love it type of situation. I think if I did it, anybody can do it. But to me, the most valuable thing is getting the time back. And I would really ask them to search themselves as to really what's important to them. And obviously, if you have anything I can help with, please let me know. I'd be happy to do so, maybe on a little bit more personal level. But yeah, I would say consider what's important to you, for sure.
I love that. Well, thank you so much, Dr. Williams, for sharing your story today and sharing the story about Foundation DPC. I'm so excited to hear what happens in the future for you.
I look forward to meeting you at one of these events, one of these days. That'll be a lot of fun. And thank you so much for having me.
Thank you for listening to another episode of My DPC Story. If you enjoyed it, please leave a 5-star review on your favorite podcast platform. It helps others find the show. Have a question about direct primary care? Leave me a voicemail. You might hear it answered in a future episode. Follow us on socials at the handle @MyDPCStory and join DPC Didactics, our monthly deep dive into your questions and challenges. Links are at mydpcstory.com. For exclusive content you won't hear anywhere else, join our Patreon. Find the link in the show notes or search for My DPC Story on patreon.com. For DPC News on the daily, check out dpcnews.com. Until next week, this is Marielle Conception.